Hello everyone, I am in Las Vegas and I'm getting ready for the HIMSS Global Conference 2026. As part of the preparations, I am about to meet the CEO of HIMSS, Hal Wolf, and walk to the venue to see how the preparations are going. Come with me. Hal, hello! Ready?
Let's go get them.
We got the badges.
We got the badges. And look, this is going to be packed wall to wall starting tomorrow.
Yeah. So it's always good to be.
These are the early birds. Good morning.
Good morning.
The what? It's so wonderful to meet so many members and people that are engaged from around the globe. That was a wonderful group of people from Finland. We had not previously met, so it was a wonderful opportunity to say hello. And you get a chance to have a selfie with amazing people.
Many memories.
I'm so honored to be able to have my photo taken with all these incredible people that have taken the time to fly a third of the way around the world.
I know.
Right, to come and visit just like yourself,
Yeah.
quite frankly. So it makes it really, really neat.
Speaking of unique experiences, I actually took the time yesterday to test the new Zoox, so the self-driving car.
Yeah.
It doesn't even have a wheel. Have you done that before? Kind of.
I haven't. I was kind of looking forward to it, and I wanted to be able to even do it this morning, but I found out that they don't start operating until 11ish in the afternoon or morning.
It's a shame. But it did get me thinking, when do you think that healthcare is going to be self-driving?
Health will be self-driving?
Healthcare, yeah. Will healthcare ever be self-driving? I mean, we're going to be talking about so much innovation and automation and AI here, so
I think that
I'm
it's a
joking.
really I think it's a great question. To be frank with you, I think about a third of healthcare should be self-driving right now.
What do you mean by that?
I think that the health model, which utilizes devices, AI, the ability to look at primary and secondary cases in terms of prevention, and being able to do self-diagnosis is now already here.
Yeah.
The question is, are we, as an industry, going to take that on and make it a part of our daily activities? Are we going to build it in? Are we going to go through the scope of practice change to take advantage of AI and the new applications that are here? I think we should. I think we have to. 2/3 of healthcare is going to remain inside the medical model, because there are just certain things you do that you have to do hands-on, face-to-face, operations, things of that nature. That being said, robotic operations are getting more and more computer controlled. We utilize the robotics in order to do more precise cuts. So there's a lot of healthcare which is becoming self-driven. And I would say our goal in the end is probably 60-40. Right now it's probably 95-5. But we can move it a lot faster in the years to come.
Yeah, and I don't think we have a chance because of the, everything's like the rising shortages, people leaving healthcare because of various reasons, needs rising. Do you want to go check how the exhibition space is?
Let's go check it out.
Is progressing. With all the automation and AI, I'm sometimes wondering, if we're up for another uphill interoperability battle, if doctors are vibe coding their new apps, because it's becoming so easy to do that just by prompting. You don't even have to know how to code.
Yep.
And I was recently at another event in Europe where an industry expert said that doctors are the ultimate vibe coders anyway, because they've always put data in the Excel spreadsheets, created their own formulas to analyze their data.
Well, Let me tell you, this is an old problem, and this is nothing new. I'm going to go way back. When Wi-Fi first came out, and before it was distributed evenly across a hospital, we had doctors coming in, setting up their own router, and in an open network, taking information onto their phone or an iPad or to a computer that they would take in the exam room, and then they were actually putting in information because it didn't exist on trolleys and it wasn't secure. And we were finding breaches in the firewall left and right. And most hospitals at that time had what we called a flat network, which means if you went through one breach, you were in the entire network. You didn't have a tiered environment, right? Which from a cybersecurity standpoint would have given you some safety. What's happening now is that we fully would expect physicians to be doing just what you said. And this is a governance issue. This is where every hospital has to have very clear rules in cybersecurity about what they are doing, who's allowed to do what is the source of the information, and if there's a demand to utilize the information within the hospital, it can't be downloaded separately to someone's AI app, or any app for that matter, right? Because if that happens, then what you're doing is you're in a situation where we simply are going to have bad information, bad apps, and it needs to be controlled by a quality committee, just like you would any diagnosis. There need to be proper protocols put in place. So one of the biggest things HIMSS is doing is helping with that governance model.
Yeah, absolutely. It's for sure becoming an increasingly big question. The governance, like the operating systems for AI agents, etc. But I do, obviously there's always another aspect. I'm always kind of critical and skeptical and stuff.
Should be.
So what about, shadow AI? Obviously for enterprise solutions, everything needs to be super regulated, tested, cybersecurity. Some hospitals don't even allow the bring your own devices approach, but then that will not stop clinicians from using consumer solutions such as ChatGPT. So how do you see that issue? And by the way, before you reply, we're in the exhibition space.
We are.
It's still being set up.
And look at that amazing booth right here. You walk right into HIMSS Connect, which is one of the best places possible. So let's go over there.
Let's go over there. What's this? It's a hall of achievements.
Yeah, this is a new feature at the HIMSS Connect booth. I'm seeing it for the first time because it just went up yesterday. This is fantastic. This is telling the stories of systems from around the world. Over here's the United States, over here's Canada, Taiwan, Korea, United Kingdom, all over. And it's the story of how did they become a stage 7? What is their background? What did they do? And what are the summaries of their accomplishments? And really what happens is a story at HIMSS. It starts right here. Governance and workforce, to the point you were making earlier about interoperability, predictive analytics, and personal enabled health. This is where we are. But what we were just talking about a few minutes ago starts right here at governance and training your workforce of what you cannot do, and putting the fundamental processes in place in order to support the right applications at the right time. Interoperability has to ensure that the data that is being utilized has been screened, it passes quality assurance, because if you start with bad data in, you get bad information out turns into bad care. So predictive analytics based upon great data, based upon governance of what you're trying to accomplish, that's what creates person-enabled health.
So as I was saying, how do you see the whole challenge of shadow AI use in healthcare and basically the fact that we're trying to control the environment to assure governance, to assure data quality, but people are always going to find workarounds. Or maybe they won't, because AI is putting technology in the background with ambient, so maybe there won't be a need for workarounds, or maybe that's just too optimistic. I don't know, what do you think?
Well, I think this is a central question. So I'm going to give you a very unexpected answer, perhaps. Doesn't matter.
Why?
Because it's going to happen no matter what.
Yeah.
So I think you have to recognize that there are going to be three areas. So one is you're talking about AI within the medical model and what happens, right? And you're talking about shadow AI applications within the health setting. And a lot of health systems are going to say, you know what that is? That's innovation. It's not a question of shadow AI, it's a question of how and when it gets applied. Mm-hmm. So someone's going to go and build something, and they may come up with an interesting answer that no standardized AI application that's operating within their environment actually has come up with. And that's okay. Mm-hmm. That's what spawned a lot of digital health transformation, with thoughtful physicians saying, I need to look at this differently than the way we're looking at it now. I can't line up behind 300 requests going against 10 SaaS programmers. So I'm going to go build it myself and see what I can come up with. Mm-hmm. And they did. And they came up with ideas and thoughts. And then once they got the attention of the standard medical model to this change, suddenly resources went against it and you built it up. Yeah. AI applications are being embedded right now in a lot of the major bigger application suites, right? So whether you're looking at a EHR application suite or digital technology or imaging technology or analytical technology, AI is everywhere. Sitting on top of that is all the AI that's built into our apps. So whether we're walking around with a phone or a Ring or a device, and that's at the personal engagement level. The biggest change that has happened to me on the predictive level is that about 10 years ago, I really expected the health model, which is wrapped around the global app ecosystem, to merge with the health model, so more and more outside applications would be integrated, which would create better engaged personal health. Yeah. And the medical model, being what it is slow, it's defensive, and the health models looked up and said, we're not waiting any longer, we're going to go build our own ecosystem. Yeah. And what they've built is basically prediction modeling at the individual level. Chat's come along, AI has come along, they're starting to draw in information. Is the information right? Not necessarily. Can it be messed with? Absolutely. Yeah. And so do you take it verbatim? Do you take it as the gospel? The answer is you can't. Everything has to be looked at with a little bit of, well, let's test it. Let's push it. And so it doesn't matter where it sits. It's all got to be tested. It's all got to be pushed. It all has to be challenged. So whether it's coming at the individual level, if it's coming at the health model level, or it's coming within the medical model, then all of it just simply needs to be challenged.
Yeah. Thank you, Hal. We will continue our discussion at the HIMSS TV booth.
Sounds great.